but you kind of get used to it. So I was hoping to think with you a little bit about this project known as Psychological Perspectives in Education and Primary Care. It's also available for adults, known as PPEPCare, which you can have training within your surgery. So for the adult service, they focus solely on primary care and with the anxiety and depression umbrella. So you can have that training there, but the young person equivalent is known as Psychological Perspectives. We've got, at the moment, funding through both East and West Berkshire to deliver training across all services that work frontline with children and young people. So I lead across Berkshire. I've got a long history of working in CAMS, and really ageing 30 years, I suppose, always as a jobbing clinician, family therapist and CBT psychotherapist. And in the last 4 years, I've been leading this project, which offers training, but also increasingly we're offering support in training trainers to offer this training as well. So we've got a kind of broader role across the Thames Valley. So I'm just going to run through, because a lot of this probably won't be relevant. What I would like to do is just summarise what might be useful and potentially available to you within your surgeries. So what we have is standardised teaching, which was developed in conjunction with GPs, young people, families, teachers, school staff, and we offer a number of modules which are either delivered by myself, my colleagues, or my specialist colleagues within CAMS services. So Emma, who you met earlier from the Eating Disorder Service, her team come into your surgery and spend a lot more time thinking with colleagues, with yourselves, around the kind of detail around eating disorders, for example. Our other specialist trainings, which I'll give you a bit more detail, are also delivered by the Autism service within Berkshire. So they're all one of the things that we set out to do, really. There's, from our point of view as a project, we're very happy if 3 things happen, really. 1, that you understand a bit more about the specific mental health issue. 2, that you really feel very confident that you're talking in a way that's evidence-based with the young person, and that you have a number of tools in your toolkit with which to make it a positive kind of intervention in the difficulty early on, which is, we know, makes an enormous difference to the long-term outcomes for our young people. So they're all written by local, national and international experts in each of the area. And one of the ideas is that really probably what we recognise is most people don't get mental health training in children and young people as part of their core trainings. I mean, my understanding is that GPs may get half a day in their 7 years, and that actually most of us, probably including myself, my original training was mental health nursing. I didn't get any young people's mental health training. So there's twofold. One of the ideas is that we don't get it as part of our core training. The second thing is that what happens is it's a rapidly shifting field, you know, in terms of particularly with anxiety and depression in young people, in what the evidence base tells us. So what we know is that there's a gap of 10 years between really good, helpful research happening and it changing our practice frontline. So we get some funding, you know, from the NHS England and also local to really push that evidence base to the front line as quickly as possible. So I just want to go through the modules that are available, and I know we've touched on some of these things today. I know that Tasif talked earlier in the context of the Rapid Response Service around the idea of self-harm. So we've got up to a day's materials, but we know you guys don't have that for your CPD time, where we'll look particularly at what the evidence base tells us about working with self-harm, and the inclusion of working with families, and that came up in a question a minute ago, and actually there's a really lovely, really helpful leaflet on your table, which I freely give to the young people's families that I work with. Sometimes the work lies in reducing anxiety in the family, actually, and helping them understand more about what's going on and not be terrified that, you know, self-harm means that young person's going to take their own lives. So this was developed by, and DBT came up earlier in Tasif's presentation, is the evidence-based treatment of approach, where lots and lots of the self-harm we'll see in young people is based on their difficulties in emotional regulation. So it's based on DBT. We use lots of qualitative evidence from young people to say about what they think they want from adults, what they think is helpful, and works with them and their families to manage that. So we also look at what the evidence bases increasingly tell us is helpful with young people. There is good evidence to say it's helpful with adults, but we're learning that behavioural activation, when we apply it to young people with mild to moderate depression, is incredibly effective actually at preventing an escalating low mood. and really looking to nip withdrawal in the bud, you know, that keeps depression going. And there are lots of really helpful practical things that we can all do in frontline roles that make a big difference. So this was developed by, I always get his surname wrong, Lejulius, I want to say. So he was the developer of the model. It's one of the key components of something called cognitive behaviour therapy. So it looks at just tackling the behaviour that a depressed mood elicits. Anxiety within people, developed by our colleagues, which is now one of the centres of excellence actually at the University of Reading. So Polly Waite's developed a lovely module for us in what the evidence tells us is most effective for anxiety in young people. We've got a lovely developing evidence base to suggest with children under 12, if we train families and the adults around them, then up to 60% of those children with CAMS level anxiety will drop below that clinical threshold. So that's really helpful information, and using some of the strategies is helpful, I think, in terms of understanding more about what we can do about that. So we have some an evidence base around parenting that looks at conduct disorder and challenging behaviour, which may be less relevant to you guys because a lot of our parenting support is now provided across county in the local authorities. So this is based on a parent training programme which looks at adults changing what they do in relation to young people with challenging behaviours and what those programmes might look like, and for some what strategies may be useful in their work. So we also have more specific modules that we use for folk that have a much more in-depth approach. So some school workers have a role in school refusal, so we go in more depth, although all the specific anxiety modules are covered as part of our broader anxiety module. So we've got one on separation anxiety, specific phobia, and obsessive compulsive disorder. The last one is post-traumatic stress disorder, which is a really helpful module, but it tends to, the evidence-based points strongly, where the research has been done, is around single event trauma. So I do quite like to make sure that people understand that, because the evidence base isn't that we have this wouldn't include what the evidence base suggests for more complex trauma that we'll often see in young people that have had, you know, difficult and challenging kind of early lives. So this is about single event trauma. And we offer an overview of mental health issues, although this is very much about information giving, and in my experience lots of people find that there's not enough to make it worth doing almost on each of the areas, because we now have up to 16 areas that we focus on. So I do occasionally deliver this for some sessions, but I don't recommend it for GP surgeries in particular, because I think it's just frustrating. This is our eating disorder module, which you saw some of the presentation of earlier that Emma presented. That's a pet care model that's been heavily adapted for GPs. We'd offer something quite different in schools, so we'd be asking them to spot eating disorders early, to talk to young people about their eating issues, so they'd be very much at the front line in engaging and feeling confident in engaging young people. They're one of the hardest groups to engage, because of course anorexia tells people that there isn't any trouble and there isn't an issue, and they're very, very careful about telling adults what's happening for them. We developed, again, some of the module you had this morning around eating disorder was based on one of two modules that we have with PPEPCare. So the first one being autism awareness, which you saw some of today, and the second one is the correlation between autism and mental health. And we know that up to 70% of young people on the autism spectrum will struggle with clinical levels of either anxiety and or depression. So it's a big issue. And my specialist colleagues that you saw this morning will be coming out to deliver those to you. We have an overall module that looks at both developing resilience and in young people, and includes some of the lovely wellbeing, mental health wellbeing research, including the 5 ways to wellbeing. I don't know if you guys are familiar with that. I have been in surgeries where that's been. So in much the same way as we have the idea that if massive meta-analysis of research where they looked at if we ate 5 pieces of fruit and veg a day, that would change our physical health. They've done a similar for mental health, which is known as the 5 ways to wellbeing, which looks at what we can do, some things we need to do every day to maintain our wellbeing. So it's about growing wellbeing, growing resilience, and that's included in our resilience module. And this is a brand new module that we developed on request, which was that lots of people struggle to know how to best help young people in crisis or distress in the moment. So it's looking at the adolescent brain, it's looking at the impact of those brain changes in interactions and relationships. It's looking at managing emotional regulation, it's looking about our own self-care as professionals. It's thinking about a model known as NOW, which structures our conversations so that we have a helpful model so that young people come away feeling that they've got something useful and we feel we've been helpful, which is always good. So we're working on 2 further modules at the moment. We're just about to pilot a module on ADHD, of which we'll have 2 versions. One for primary care, colleagues like yourself, where we'll be looking at things, the shared care ideas, thinking about medication and other things. And we're developing another module that we hope will grow confidence in supporting frontline professionals in keeping young people out. We're talking with young people and their families together, because we know that has a big impact on outcome too. So we do have now a 4-year evidence base to suggest that the modules do have the impact we hope they did on outcomes, and we have feedback, both qualitative and more quantitative, showing a really robust evidence base that the project has been useful. So there's an invitation for you to contact me. On your desks is a flyer that gives you more detail on the modules. Please feel free to contact me. My email address is there if you'd like training for your practice, further in-depth support. And also just wanted to draw yourself, excuse me, draw attention to some of the resources that we bring when we do training. So with each of the different areas, there are CAMHS recommended resources, but this I think is one of the most useful ones, because on there are apps, websites, self-help materials that I freely give to the families that I work with. Electronic copy is quite helpful because the links are live in it and take you straight to those. So like I said, we would have a look yourself, but in CAMHS we're certainly confident to give those out to families as well. I know you've had a long afternoon. I just wondered if they had any questions. I don't want to bombard you further about either any of the PEPCare modules that you saw